Hey, it's Dr. Tim Varghese with Movement Solutions. Today we're going to go through 3 great exercises to improve your knee health. When it comes to improving knee health, mobility, stability around the hips, knees, and ankles are really important. Today we're going to work on some exercises that are going to address all of those areas, as well as a great stability exercise to get that knee working through a full range of motion, engaging all those muscles. So we're going to start with an active calf stretch. For the active calf stretch, Taylor's going to follow me, and we're going to walk over to the wall. And she's going to set up in a lunge type of position, just like she would if she were in a high school PE class. In this position, she should feel a nice stretch through that calf, but we're going to add a little twist to this. Taylor's going to go up on her toe on that right side. She's going to pause, and then she's going to drop back down, and when she drops back down, she's going to really try to close that area in between her forefoot and her shin, and really try to activate those muscles around the ankle. She's going to hold that for about 2 seconds, and then she's going to come up on her toes again. She's going to repeat that cycle between 3 to 5 repetitions to really get a nice active stretch through those calves, as well as activate those muscles around the ankle to get some great mobility through that ankle joint, through that back of the knee that could be affecting knee health. After the calf stretch on each side, what Taylor's going to do next is to go into an active hip flexor stretch or a leg lock bridge. So for the leg lock bridge, Taylor's going to lay on her back, and she's going to hug one knee to her chest. She's going to bend her other knee so her foot is flat on the ground, and she's going to bend it just a little bit more, her knee. She's going to pull that foot up in the air, and she's going to tighten up her glute on that left side and push her bottom up in the air. She's going to hold that for 2 seconds. After 2 seconds, she's going to drop back down. She's going to do that between 3 to 5 repetitions, really opening up the hip flexors, as well as engaging that hamstring and engaging that glute to help improve that mobility around the hip, around the knee, and as well as cue some glute stability as well, which will help with knee pain and knee discomfort. After about 3 to 5 repetitions of this exercise, she's going to reinforce all of this with an active stability exercise, and we're going to use a banded goblet squat for this. So Taylor's going to put a medium resistance band around her shins just to give her some feedback. So oftentimes with people who've got some knee discomfort, one of the reasons is that when they're moving in squat motion or going up and down steps, the knees tend to cave in. And the band can help cue against that, because the band's going to drive her knees in a little bit. In order to prevent that, she's going to have to push out against the band. She's going to use a kettlebell here just as a counterbalance for the squat, and then she's going to drop into a squat. She's going to pull herself deep, as comfortable. She's going to pause at the bottom and really own that position, and then she's going to come all the way back up, really get some nice extension through the knees, some nice glute activation at the top, and she's going to repeat that between 5 to 10 repetitions, really getting those quads working, the glutes working, getting the knees to flex and extend, as well as fight against that caving in that is common with folks that got some knee discomfort. So if your knees are kind of creaky or not functioning like you feel like they should be, try these 3 exercises to improve ankle mobility, knee mobility, hip mobility, as well as this great banded goblet squat to get some stability through multiple muscles that cross those major joints. So try these out and let us know what you think.